Chapter 17, Injuries Are Not Accidents, based on Introduction to Public Health by Mary-Jane Schneider, 6th edition. When you hear public health, you probably think of disease. But what about injuries? Injuries are the third leading cause of death in the US and the leading cause of death for people under age 50. Car crashes, falls, homicides, overdoses. And here's the thing, these aren't just tragic accidents. They are predictable and preventable. Injury as a public health problem. Public health looks at injury the same way it looks at disease. We ask, who's at risk? Where is it happening? How can we prevent it? We use tools like surveillance data, risk analysis, policy and environmental change. The CDC even has a dedicated injury center because injuries are that important. The injury pyramid. Let's talk about the injury pyramid. At the top, death, but that's just the tip. Below that, hospitalizations. Emergency room visits, minor injuries that never get reported. For every one person who dies from an injury, hundreds more are hospitalized or treated. So to improve public health, we need to look beyond the fatal cases. Types of injuries. We categorize injuries as unintentional, falls, car crashes, poisonings. Intentional, suicides, homicides, assaults. Both types have huge public health impacts. Unintentional injuries cause more deaths, but intentional ones, like gun violence, carry deeper social trauma. Understanding injury host, agent, environment. Just like infectious diseases, we analyze injuries using the host, the agent, the environment, take car crashes. Host, the driver, agent, kinetic energy of the crash. Environment, road conditions, lighting, seatbelt laws. Once we know these factors, we can apply primary, secondary, and tertiary prevention. The 3 E's of injury prevention. Injury prevention comes down to the 3 E's. 1. Education, public awareness, safety campaigns. 2. Enforcement laws, penalties, legal mandates. 3. Engineering safer cars, child-proof caps, speed bumps. It's not just about changing people, it's about changing systems. Motor vehicle injury. Car crashes used to be a leading cause of death, but thanks to seatbelt laws, airbags, speed limits, anti-drunk driving campaigns, crash-resistant car design, deaths have dropped significantly. Still, distracted driving and impaired driving remain big threats, especially for teens. Poisoning and the opioid epidemic. Poisoning is now the leading cause of injury death in the US. Most are from drug overdoses, especially opioids like fentanyl. Public health responds by tracking overdose data, expanding access to naloxone, promoting harm reduction, supporting treatment over punishment. This crisis isn't just medical, it's a public health emergency. Firearms and violence. Gun injuries are highly politicized, but they are also preventable. More than half of gun deaths are suicides, not homicides. Public health calls for research funding, safe storage laws, background checks, community violence interruption. The goal isn't to ban, it's to prevent harm. Occupational injuries. Workers face risks too. Injuries from construction, agriculture, transportation, repetitive motion, and overexertion. Agencies like OSHA and NIOSH set and enforce safety standards. But many low-wage, undocumented workers fall through the cracks. Domestic violence and TBI. Some injuries happen at home. Public health addresses child abuse, elder abuse, intimate partner violence. Another rising concern, traumatic brain injury, especially from sports, falls, and combat. Long-term effects include memory loss, depression, and disability. Tertiary prevention, EMS, and trauma care. When prevention fails, we rely on emergency systems. Tertiary prevention means fast EMS response, trauma centers, rehabilitation services. Saving lives depends on quick action, trained professionals, and regional coordination. Conclusion. Injuries aren't random. They're not accidents. They are predictable, preventable events. Public health reduces injury through education, enforcement, engineering, emergency care, and above all, by creating safer environments for everyone. Call to action. This presentation is based on Chapter 17 of Introduction to Public Health by Mary-Jane Schneider, 6th edition. If this helped shift your perspective on injury prevention, share it and tell us in the comments. What injury risks do you see in your community and how could they be reduced?